Alleviant Integrated Mental Health is one of the nation's most forward-thinking mental health organizations. Mears, founder and CEO, joins us to talk about how its mission has grown and how the cutting-edge treatment makes their approach to care different. Brian, thank you so much for being here today.
Being here.
Hey, thanks for having me on.
All right, we want to hear the Alleviant story.
Oh, boy. Well, Alleviant started in October of 2017 with a little idea to change the whole aspect of mental health. It was just a little idea, but you know what? After 8 years, we're finally starting to make a big impact. So right here in Arkansas, we now treat over 100,000 patients a year.
And you're doing that a little bit more differently than others do it. What are the treatments that you offer?
Yeah, so we do everything traditional outpatient psychiatry. So that's a combination of diagnostic evaluations, medication management, things like therapy. So that's traditional psychiatry. But then we also do lots of forward-thinking, newer things where we use objective brain-based techniques such as spectral EEGs to guide all of our treatment plans.
Explain a little bit more about what that is.
All right. So have you ever went to the doctor and had a blood pressure checked?
Yes.
Yes, we all have, right? And before you're put on a blood pressure medicine, they're going to check your blood pressure. They're going to monitor your blood pressure throughout the course of treatment. The same thing for blood sugar. You'll never be put on a blood sugar pill without checking your blood sugar. But in psychiatry, we really just prescribe medicines based upon what you tell us. But what you tell us can change over time.
Right.
And so what we've done is we have a tool called a spectral EEG. We do that in our clinic. It only takes 4 minutes. It's wireless. There's no glue or gel. We slide it on. We can do this on children as young as 3 years old.
Take a look at pictures there.
Yeah, absolutely. So that's a spectral EEG. And this gives us that vital sign, if you will, like a blood pressure for the brain. It gives us an objective measure to then hold accountable our treatments.
Yes, because what we tell you is subjective.
Absolutely,
right? And so
yes.
you're getting some hard data there that you can really work with.
It's very important.
Yeah.
So you're looking at the EEG, the findings there after it's all done,
Right.
and what are you reading off of that? Like, what do you see from some of your patients?
Quick physics lesson into 5 seconds. We're reading your physical brain waves. All right. What we're trying to do is look for your calmest wave and help you replicate that wave. So what we're doing is when we look at that wave, we can largely see lots of patterns in that. We can see depression, we can see anxiety, we can see autism, we can see brain injury, sleep apnea. We can see those things in your brain waves. Your brain keeps the score. Your neurons tell us habitually what you've been through. And so without you ever telling us anything now, we can look at your brain, we can look at this objectively and tell you most likely what you've been experiencing in life.
Wow, that is fascinating. Is there something that's normal, or are they like fingerprints? Everybody's different, slightly different?
Every person is different, but sure, we have an ideal brain wave. And so we measure against what would be considered perfect or ideal. Now, is it normal to meet somebody with this perfect unicorn brain? No, it's not, because we're all people that have been through lots of stress in our life. I'm not talking about just psychological stress. I'm talking about physical stress. We live in an environment that creates stress, meaning we get flu, we get colds, we have histories of COVID, we've had injuries before. All of those are stressors to our brain. Our brain will keep the score. Now we can finally see that scorecard on an objective measure called spectral EEG.
Give us an example of a success story of someone who's come in and they've seen tremendous results.
Oh, well, there's thousands. And I do believe you were in the clinic about 2 months ago and you heard a success story. I would encourage anybody to go back and watch that mother share her story of her 2 children and her husband that received treatment from us. But, you know, there's so many stories where I've seen veterans and first responders who were they were scared to death to come in and get a diagnosis. Because when you have a diagnosis, many times under traditional psychiatry, that comes with a treatment plan of medications and other things that people sometimes don't really want. So I remember a veteran distinctly that came in and saw us. Not really. He did have a history of mental health issues, but when we did his EEG, it was very easy to see that he had a traumatic brain injury and he had PTSD. When he saw that, it created validation that this isn't just in my mind. It's not just something that I'm experiencing that I shouldn't. No, your neurons have been damaged, and you see that objectively. It adds that validation, and then when we start treatment to correct that, which is another innovative treatment, we can physically do that, like physical therapy for the brain, to modify your neurons without modifying your mind. When we treat the brain, the mind then follows. And so it helps them so much.
Oh, my, yeah. You know, ignorance is not bliss and hope is not a plan. Go see somebody like you, and you're doing things that really haven't been done at all before. If people want more information, tell us what they need to do.
They just need to go to our website at alleviant.com. That's ALLEVIANT. Or call us at 866-951-4325.
Perfect, Brian. Thank you so much for your time.
Thank you for having me on.
See you. Congratulations on
Thank you.
everything you've done.
Thank you.
We'll have more Good Morning Arkansas after this.